The topic that I bring is the CDC yesterday saying that they pretty much expect the coronavirus to spread to the U.S. Houston being a big city with an international airport, people coming in, coming out. Is the city ready for this? What the city is calling inevitable coming of the virus?
Well, we've certainly been taking steps to be prepared for it, and we'll continue to make those steps to be prepared. I know more than several weeks ago, I met with some of the leading doctors at Texas Medical Center and the executive team over there, along with Dr. Persse and Chief Pena and others, to get updated on the steps that were being taken. I fully expect every hospital and every clinic, for example, in the city of Houston, to be taking the necessary steps now to make sure that they put the proper protocols in place so that they will know what to do if a case should present itself. And I've urged them to be prepared even now to take advantage of the fact that we don't have any confirmed cases in the city of Houston. But let's hope for the best. Let's prepare for the worst. And that's my view. We hope for the best, prepare for the worst. And so I expect every hospital, for example, and clinic in the city of Houston to put in place now, right now, before any case presents itself, the protocols, what the steps will be, and I know Dr. Persse has been having conversations in that regard.
Thank you, Mary. So I've been talking with all the hospital systems and many of the clinics and asking them to prepare for a large number of patients coming in seeking help. We recognize, because this isn't the first time we've dealt with viral illnesses, and we deal with the flu every year, we know that there's going to be some number of patients who are going to probably just be what we call the worried well. They're concerned, but they actually don't have the disease that we're worried about. We also know that amongst that group of folks, some of them actually will be infected with the virus that we're concerned about. And then within that group, there will be some who not only are infected, but are actually sick, requiring hospitalization. And so what I'm asking the hospitals to do is to set up a system like we've used in the past where I'm advising them, it's up to them as to how they will do it, but I'm advising them to have a separate area for triage. One reason being that in the group of folks who are complaining of viral symptoms, some of them will be infected, and we don't want them inadvertently infecting patients who have got other more complicated medical problems, which would put them at greater risk. So to some degree, if we can segregate them off to a different area near the emergency department, the majority of those patients should be able to be evaluated and taken care of by the doctors and nurses very quickly and get them in and get them out. But as I said, some of those patients will be sick enough to require hospitalization. So the hospitals, in addition to having a streamlined approach in the emergency department to take care of folks with viral symptoms, apart from the folks with heart problems, liver problems, intestinal problems, and all the other sorts of things that the emergency department deals with, and trauma patients, for example, but to have an area where they can be quickly evaluated and properly cared for, then those patients who are sick enough and infected with the virus who need to be admitted, they will need special care inside the hospital. And so generally, the recommendation for patients like this is they're put in what's called as a negative pressure room. So that's where the air is always sort of like being pulled out of that room and filtered so it doesn't spread throughout the hospital. Well, hospitals have a limited number of those. Not every room in a hospital is built that way. So in anticipation that the hospitals fill all of their existing rooms and they have more patients, they need to come up with a contingency plan for that. And so I've been discussing with them several strategies of how they may be able to accommodate those problems. And each of the hospital systems I've talked to are leaning forward and coming up with plans. And a lot of them are, fortunately or unfortunately, depending on how you want to look at it, back in 2009 when we were worried about H1N1, we did a lot of planning then. And many of those plans will be perfect for this situation. So they're going back and they're opening up those plans, updating them because things have changed, and updating them and then planning and implementing those. So as a whole, I think that the city is pretty well prepared. It's really going to be a question of how big does this get and how quickly does it get, and how long does it last? And those are questions we don't have the answers to yet. But as the mayor pointed out, it is our job, and it is the hospitals and the clinics' jobs to prepare for the worst, to anticipate the worst and be prepared for it. And hopefully it won't be that bad. And if this is all said and done and we get accused of having over-prepared, I will gladly take that criticism.
And I want us to over-prepare. And Dr. Marlene McNeese with the City of Houston Health Department is also here, and she's working very closely with Dr. Persse and getting the message out to our healthcare delivery system is that it's better for us to be over-prepared and not need the preparation than to underprepare and then have to ramp up very, very quickly. So we're taking advantage of this time while the virus, as it relates to the United States and the city of Houston, is contained and all of that. We want to make sure that we are doing what we should be doing to prepare for any case that may present itself, so there's not confusion and that we are ready. So that's the main thing. So again, I want to emphasize the message from me to our healthcare delivery system is that while there are no cases in the city of Houston, I want us to be, as much as possible, be prepared. Everybody should know what the steps should be. It's just like a fire drill. It's not a fire, but you have the fire drills anyway. So the same thing as relates to the coronavirus. No case presented itself right now in the city of Houston, but let's prepare. Let's hope for the best, prepare for the worst.
Major, there's no cases of coronavirus,
No.
but on the Asian community, it's affecting the businesses, and they're spreading rumors that they might get it. What do we have to say to them?
And again, and we've said it before, and it's worth saying again, there are no confirmed cases of the coronavirus in the city of Houston. There are no confirmed cases of the coronavirus, for example, in Asia Town. That it is safe to go to restaurants and businesses in Asia Town or any place in the city of Houston. That there are no confirmed cases. There's no reason for anyone to be staying away from any restaurant or any business because somebody has said that the coronavirus is here. That is not the case. And I think next week, they're planning a visit by me to go and have dinner or lunch in Asia Town, and I look forward to doing that. If there is a case that presents itself, we will tell you. Okay, we will tell you. We're not gonna keep that from the public. But let's not act on rumors.
Have you heard about the economic impact? Have you talked to them? Sit down with them?
There are some businesses that where the amount of traffic has been reduced by, let's say, 70%. In some cases, may have been close to 90%. So there's no question that people are responding to these rumors, but that's unfair to these businesses. And people who worked hard and long to establish themselves. And, social media can be good, but social media can also be very, very bad, especially when it disseminates misinformation. So, again, let me encourage people in the city of Houston to continue to conduct their business, to continue to patronize people in Asia Town. And we're specifically saying Asia Town because that's the area that's been the hardest hit by these rumors. But the main thing is that, I want the city to take the necessary steps to be prepared, and certainly the healthcare delivery system, our clinics, our hospitals. Let's not wait until something happens, and then we're scrambling to get there. And again, let me encourage people to wash your hands. All those things that we tell people about the flu, those are things that we can do, wash your hands and all of that. And but we're all working to be prepared.
So a question
Yes.
that I have for the doctor. Doctor, if you mentioned that you're working with the hospitals in order to create a system, right, in order to act in case it presents the coronavirus in Houston, but is the city ready in order for implement a massive quarantine if necessary? If you have, dozens of cases in Houston, is the city ready and has the installation to activate a quarantine?
So we need to get our terms straight. So quarantine is different from isolation. So if we had sick people and we had huge numbers of them, that would actually be isolation, not quarantine. And we have had plans. Remember back, I mentioned earlier, the 2009 H1N1 scare, there were plans that were developed for exactly that purpose. And so we do have plans. Heaven forbid we have to actually use them that it would get to that point. But yes, we do have plans on how to increase the capacity of the city overall to take care of patients if it got to the point where even the hospitals couldn't handle it. It would not be elegant, I will tell you that right now, because we would be taking structures that are not designed to be hospitals and sort of forcing that to occur. And staffing is going to be a challenge as well, because if the hospitals are all full, a lot of the medical people in the community are going to be stressed and working. And so there is a plan. Hopefully we never get there, but yeah, we have actually thought in the event that it gets that bad, we have started laying plans for that eventuality.
Dr. Persse, what about, we have so many companies that do business overseas. Have you talked to, or has the mayor talked to any of these large companies about what to do with their employees coming back if they're from an area that's been infected or anything?
Well, I have talked to some, but so yeah, we have reached out to some of the large employers in the area and talked to them about their international travel. And fortunately, with those large companies that have a lot of people in international travel, they also have very robust internal medical systems in place with very experienced physicians and nurses. And today, it seems to me that their plans are pretty intact. And of course, a lot of that international travel has stopped, right? So they're trying to do a lot more things remotely and through teleconferencing and so on and so forth. So a lot of that travel has slowed down to a great deal in order to minimize the risks. But we have been in touch with them and heard their plans and given some advice, and we've got a great working relationship with the ones that I've spoken with, yes.
Dr. Marlene Magnish, is there anything that you want to add? Dr. Marlene Magnish.
Good afternoon.
City
Good
of Houston
morning.
Health Department.
One of the things I would like to add is how much, under the guidance and directive of the mayor, we've been working with other city departments to make sure that we are ready to respond, particularly our first responders and our healthcare and public health personnel, just ensuring that we've got necessary supplies and we've got our plans intact in order to be able to respond and help the residents of Houston.
Okay, Doctor, I understand that soon maybe the CDC will be giving the test kits to the city public health department so that we could do it faster and quicker here.
Yes, that's their plan. Our local laboratory is part of a larger nationwide network of resource laboratories, and we have been testing some of the earlier kits that CDC deployed, and we're waiting on those final kits to be shipped. There's no estimated timeline for when they will be shipping to local laboratories. So right now, CDC is still the one and only public health institution that is providing and doing those tests.
Do we know how many kits are the city receiving?
We don't know yet an estimated number of how many kits we would receive.
So again, I want to underscore no confirmed cases in the city of Houston, at this time. But we are taking steps to prepare ourselves. We are hoping for the best. We prepare for the worst, and just want to assure people that steps for preparation have already begun, and encouraging the entire healthcare delivery system in the city of Houston to treat it like a fire drill now. So make sure that everybody, key people at the hospitals and clinics, know what the protocol is in case a case is presented. That's important because we don't want something to happen and then people don't know, and then that's mass confusion that just makes the situation worse. So let's take advantage of the time period now, and certainly we'll stand in contact with the CDC. And then we'll, like everybody else, we're getting information. We're taking a look at where cases are presenting themselves outside of the United States. So if people are looking at traveling some places, just exercise some good judgment, check and see where you're flying and what's happening, especially if you're traveling outside of the United States. Just do that. That will help everybody as well. So that's where we are. Any other questions? Thank you all very much.